Good afternoon. I'm Jeff Flax, the President and Chief Executive Officer of Hartford HealthCare. And today's a wonderful day for the city of Hartford. It's a wonderful day for Open Hearth, a wonderful day for Hartford HealthCare. We're so proud, we're so pleased today to bring our mobile testing site here to Open Hearth. We've been working very hard at expanding our testing capabilities and creating our mobile capacity that we will be rolling out now every day in different locations so that we can increase access and bring our care, bring our services, bring testing to the people who need it most conveniently, and where it'll make the greatest differences. The relationship between Hartford HealthCare and Open Hearth is a historic relationship. Hartford Hospital was founded in 1854. Open Hearth was founded in 1884. These two institutions have seen so much trial and tribulation, successes in circumstances in this city. And together in this moment with COVID-19, we are again coming together to address one of the great challenges of our time. Today we tested 105 people in this facility who are staying in this facility. We're enormously proud to be able to do that. We tested the people staying in the facility, and we also tested all of the people who are working in this facility. And going forward, this is the type of testing that's necessary so that we can bring the region back to work, so that we can start bringing people back into circulation, so that we can have the mass type of testing we need. And at Hartford HealthCare, where we're starting it, are in the places that we think are the most critical and essential to the community. We also are in active discussions right now, and hopefully we're going to have another announcement in the very immediate hours, if not day or so, around a new location in the north end of Hartford that will be adding an additional testing site here in Hartford. We also, within Hartford HealthCare right now, are building new centers that are opening up this week and the first of next in Mystic and in Westport, in Newington, and in Enfield. So we're continuing to both expand fixed locations, as we will be doing in the north end of Hartford, as well as creating this mobile capability so that we can be responsive to where the needs are greatest. So we're delighted to make substantial progress. Testing is absolutely critical as we move forward and as we beat this within our region. And it's most essential in our cities across Connecticut. And that's where this mobile capability is essential, and the fact that we need to stand up more centers like we have in the south end of Hartford today on Hudson Street, which is critical. We'll be doing, in the city of Hartford alone, in Hartford HealthCare, we'll be doing close to 700 plus tests a day just in the next several days, each and every day, as we build out new permanent locations and activate this mobile capability. So we're excited to be in the south end, stand a center up over time in the north end as we put that together, and then use this mobile apparatus as additional capabilities. The partnership throughout this process for COVID-19 with the city of Hartford and with leaders like Marilyn and organizations and facilities like Open Hearth have been critical. How we respond to the challenges in this region, it takes a village, and it takes collaboration, and it takes coordination, and the support we've had from one another has been absolutely essential. But it begins with leadership. And the mayor for the city of Hartford, Luke Bronin, has risen to this challenge. I speak to him nearly every day, multiple times a day. He's been pragmatic in terms of addressing issues around regulations, around challenging kind of the status quo in order to do what's right and to do what's necessary. And we're working through not getting caught up in bureaucracy and things of that nature because he's so focused and so purposeful. He's been a wonderful partner to all of the healthcare industry in this region and all of the hospitals as we respond to this issue. And activating our mobile service and building out our additional services, his leadership has been crucial to allowing us to move this quickly and to move this effectively. So with no further ado, I want to introduce our partner in how we're responding to this COVID-19 crisis, our good friend and one of our greatest advocates and supporters, the mayor for the city of Hartford, Luke Bronin.
Good afternoon, everybody. Thank you so much, Jeff, for your partnership and your team's partnership. You know, Hartford HealthCare has been on the front lines from the beginning of this. They were working hand in hand with the city, with the state, with other healthcare institutions before we really started to see cases arise here. And Hartford HealthCare team has been working tirelessly, and so many of them have been putting themselves at risk to care for others, and we're so lucky to have them here and so lucky to have them as partners. And I particularly want to say that Hartford HealthCare has shared our sense of urgency about expanding access to testing. We're very fortunate that Hartford HealthCare entered into the partnership with Quest Diagnostics recently, which dramatically expanded that capability. But equally important, Hartford HealthCare was right there with us in recognizing that we need to make sure that we are removing barriers to access to those tests and that we are placing testing facilities in ways that maximize access. And so I'm hugely grateful to Jeff. I also want to say just a word about Sarah Lewis, who is their vice president and has been focused in partnership with Liani Arroyo, our health director, on making sure that as we battle this pandemic, which we have seen has disproportionately hit communities of color around the country, that we're doing everything we possibly can to try to minimize those disparities, to prepare in advance to try to reduce the impact and mitigate it here in the city of Hartford. So I couldn't be more grateful. And this partnership today, which we announced last week, is a really significant development. You know, as we begin to talk about the next phases of this battle against the coronavirus, an important part is going to be expanding testing and expanding testing in facilities like this at Open Hearth, where you have staff and residents who are here 24 hours a day. It's going to be critically important that we can identify, now that we've learned how many people can carry this virus without symptoms, that we identify who may have it and who doesn't, so that we can have a greater sense of confidence as we talk about moving to the next steps. We are working closely with Hartford HealthCare to implement the plan for where mobile testing goes next. We are talking about prioritizing other facilities where we may have homeless residents. We're talking about our skilled nursing facilities and nursing homes as well as others, and we'll work side by side to systematically make this mobile testing capability available. I also want to say a tremendous thank you to the healthcare professionals from Hartford HealthCare who are here administering the tests. To do 105 tests at one site is a really significant advance in this fight, and I cannot thank the Hartford HealthCare team enough for their work. With that, I'm pleased to turn it over to someone who wears many hats. She is a city councilwoman, but she also is the longtime director of this great facility here at the Open Hearth. Someone who cares deeply about the city of Hartford, but more than that, cares deeply about people. And we're so lucky to have her doing the work that she does. So over to Marilyn Rossetti. Thank you so much, Marilyn.
Thank you, Mayor, and thank you, Jeff. I just want to end with how much this means to not only myself and the clients and the staff here, but really to the city. Testing is the way we're going to really turn this around, and being able to work with Liani from the city of Hartford and others to get this done in such a short period of time is just amazing. And I also want to give credit, certainly I'm biased, to my city of Hartford. We have from the beginning really looked at people experiencing homelessness as a priority, and I don't think that probably can be said in every community across this country. So I appreciate that we've done that, and today really will make a difference. So thank you so much.
I'd like to invite up Sarah Lewis is our Vice President for Health Equity, and she's an important force across the state of Connecticut. We often talk about returning to normal when we get to the other side of the COVID-19 crisis. When we look at health equity in the state of Connecticut, we are not looking to return to normal. We are looking to be better. We're looking to make important improvements and advances, because there are clearly lessons being learned. There are clearly examples where there are communities, where there are people, there are individuals who are being impacted disproportionately during this crisis And it's because of underlying health inequities that do exist that we have to do better as time goes forward, and we will do better. And I want to introduce a great leader, Sarah Lewis, who is going to help drive this as we go forward into the future across the state of Connecticut.
Thank you, Jeff, and good afternoon, everyone. I'm Sarah Lewis, Vice President for Health Equity at Hartford HealthCare. And as Jeff mentioned, the normal that we came from is definitely not the normal that we want to return to. And that means rethinking, redesigning, recalibrating the way that we think about healthcare delivery. Bringing mobile testing to our community members who need it, where they need it, is one of those ways that we can recalibrate our healthcare delivery, and bringing it to our frontline staff here at Open Hearth, to Marilyn and her team who are working every day to protect our neighbors who live in these facilities and to prevent the spread of this disease and to prevent the disease from impacting them disproportionately. That's the sort of model that we want to replicate going forward. We want to replicate the model of working closely with our extraordinary leaders in city government here. Mayor Bronin, his team, Leonie Arroyo, Director for Health and Human Services here in the city of Hartford, have been incredible partners, thinking creatively, thinking innovatively about how we can collaborate, put the needs of our citizens first. We have talked about the disparities that existed prior to the emergence of this crisis, a 15-year difference in life expectancy between the north end of Hartford and West Hartford Center. There are longstanding issues that we need to address, and we have been working to address them, and this just makes that urgency even more real in the way that we feel it. And so at Hartford HealthCare, what we want to do is we want to keep stepping up, we want to keep showing up, and we want to tell everyone who works in our communities, lives in our communities, that we see them and we need them, and we're here to protect, prevent, and work with you going forward to survive this crisis. Thank you very much.
Thank you so much again, Jeff and Sarah and Marilyn. And now I'd like to ask Leonie Arroyo to come up. And Leonie, as you know, is our health director. But as I said, she has been working hand in hand with Sarah Lewis at Hartford HealthCare and with all of our partners to try to make sure that we're doing everything we can to remove barriers to access, to expand care. And we're just very lucky to have her as our director. So ask her to come up and say a few words on this partnership, and then to, as we try to always do, reiterate a couple of key points in Spanish as well. Thank you so much.
I can get this off now. Good afternoon, an hour at this point. But I just want to really say thank you again to Hartford HealthCare and especially to Sarah. When this pandemic started and we were looking at the communities that were most in need and most at risk for spreading the disease asymptomatically and symptomatically, we really looked at our homeless population and our individuals who are experiencing homelessness in this community. Many of these individuals are individuals who are seeking assistance from many different providers and will eventually become the individuals that are our essential workers, right? They will become the individuals that are working in our grocery stores, working in nonprofits, assisting other individuals that are in similar or were in similar situations as they are. And so when we brought this to them, it could have been very easily that, no, that's not where we want to focus. But Sarah immediately got into action and we started working together. And I think it's a testament to their commitment to the community. It's also a testament to their commitment to vulnerable populations. And as everyone has said previously, we don't want to go back to normal here in the city of Hartford. We want a better normal, and that better normal means that our vulnerable populations, our populations here most at risk as a majority minority city, have access and are able to access those health care that they need, the services that they need, so that we can ensure that when we have a second iteration of this, if a second iteration comes, that we're prepared, we're ready, and that these communities are ready. So I'm going to switch over to Spanish now. Hoy le queremos dar las gracias a Hartford HealthCare por estar aquí con sus pruebas móviles. Hoy hicieron 105 pruebas aquí en Open Hearth, que es un asilo para desamparados, un refugio para desamparados. Ellos aquí vinieron porque vieron una necesidad y están haciendo una colaboración aquí con nosotros en la ciudad de Hartford. Van a seguir expandiendo las pruebas móviles. Han hablado de hacer un centro de pruebas en la parte norte de la ciudad, donde hemos visto mucho de la pandemia y de la propagación de este virus. Así que estamos muy felices de estar con ellos como colaboradores, siguiendo trabajando juntos para estar seguros que esas personas en nuestra comunidad que tienen las mayores necesidades pueden tener acceso a una salud buena, porque no queremos regresar a lo que se dice es lo normal. Queremos un normal mejor aquí para los residentes de la ciudad de Hartford. Gracias.
Sure. These tests, what's the turnaround? This can be done by West in Massachusetts, and how fast will the results come back?
Expected turnaround for the test?
2-3 days.
We're hoping better than 2 days, but we model 2 days.
Can you come to the microphone, please? Thank you.
Yeah. So the question was about the turnaround of these tests, which typically we expect to be between 1 and 2 days.
By Quest up in Massachusetts?
They're done by Quest, yes. Typically done by Quest. We do some tests at our own facility at Hartford, but the vast majority by Quest.
Who's eligible to get tested at the facility?
So we tested everyone in the facility.
But can the public come here, or is it just for the people in the facility?
Well, today was a mobile test that was done strictly here for both the staff and for all of the people living in the facility. But when we do mobile testing, it's going to be broadly open to all the people who can come to support it in that location on that given day.
But Freddie, you can add that there are, right now, because there are 2,000 more tests, really, truly, if anybody needs a test, well, it may not be here at the mobile, we have Hudson Street where anyone can drive through, and that's what the
So I just want to add a few things, because this is a really important point. Over the past week or so, there's been a dramatic expansion of testing here in the city, and we really want to encourage anybody who feels that they need a test. If you are experiencing symptoms, you think you may have been exposed, you're working in a place where you are more likely to be exposed, you're caring for others and you're concerned about exposing them, please seek a test. And there are a number of ways to do it. You can contact your healthcare provider directly, including federally qualified health center, your FQHC. So if you're in the city of Hartford and the most accessible healthcare facility for you is an FQHC, like Charter Oak Health Center or Wheeler or any of the other 5 in our city, then reach out there. You can get a prescription, and then that prescription will allow you to get tested at Hartford Hospital's facility on Hudson Street. The mobile testing that's happening here is designed to make sure that at critical facilities where we have, first, we're focused on those facilities where we have a particularly vulnerable population and we're concerned about a potential for rapid transmission that could prove very dangerous in such a vulnerable community, that we're doing broad testing of everybody in that facility, everyone who's living there and working there, as we've done here, and that's the kind of mobile partnership that's going to continue. But again, as Jeff said, and as Rebecca said, if you are not in one of these facilities where the mobile testing site is going to first, but you need a test, those tests are available to you. Reach out to a healthcare provider, including an FQHC.
Yeah, and I would add, importantly, when somebody doesn't have a healthcare provider, dial 860-972-8100, and we'll schedule the test for you. So this is about access, and we're going to do everything we can to get everybody a test who needs a test. So they're really, we've removed effectively all the barriers to testing, and that's our objective.
There's an awareness that some Black and brown communities have mainly rely upon public transportation, might not have access to a car, and we're about 2 months into this, and so for some might say that this seems like a bit of a delayed reaction, especially because a lot of those households are multi-generational and are in close proximities. Can you just talk about people who might feel like this is a little late, a little delayed for their communities?
I'd be happy to speak to that, and this is, one of the ways that we're bringing testing to people and making it more accessible. We have allowed walk-ups through our Hudson Street drive-through facility, but we haven't really wanted people to necessarily have to do that, and so we're testing out this module or this mode of testing today here on site at this facility. figuring out what works, learning from our expert professionals on the testing team, and then we're taking that back into our team to figure out how we can bring that to more people in more places so they don't have to come to us. That is the goal. And for those who feel that it's too late, I understand, and that's a totally valid feeling. But we've been working behind the scenes to figure out, once we have access to greater capacity, what we're going to do with it. And the number one priority is access. So once we have that testing capacity, we want to bring it to people where they are.
Just to add two things. One, I don't think that anybody up here would say anything other than that the expansion of testing capability has been way too slow nationally. I think everybody here has been enormously frustrated by the pace of testing in this country, by the constraints in the supply chain in getting those swabs and other materials. And so I think the major constraint, which didn't apply to any particular community but is true across the country, is that there was far too little testing being done nationwide, in Connecticut and here in Hartford. We're fortunate that this partnership between Hartford HealthCare and Quest has allowed them to dramatically expand that testing capability so that they can drop that threshold and no longer apply that very strict screen that the CDC was requiring of multiple risk factors or severe symptoms. Now that test can be administered much more broadly. To the specific point you made, which is a really important one about access to vehicles and access to transportation, we have set up a system where we are providing free transportation for anybody in the city of Hartford who needs to get free transportation from home to the testing site and back. And so just to reiterate, if you call 311, you can get transportation from your home to the testing site, and hopefully that eliminates a significant barrier, because we're in a community where about a third of our households don't have access to a private vehicle.
How are you all communicating? How are you communicating the different pop-up sites and the different van sites each day to people in the community?
I mean, right now, most sites where the public can and should go are fixed sites. Right? There's the Hudson Street location where the expansion has dramatically increased the number of tests being done, and we can take you to that site. So what I would say is the simplest message is we still have 2 hospitals that are administering the vast majority of tests, at St. Francis and at Hartford Hospital. We are here today with Hartford HealthCare, which has seen a rapid and massive expansion of testing capability. If you need a test, as Jeff said, call 860-972-8100 or reach out to your healthcare provider and go over to that Hudson Street site to get a test. And if you can't get there because you don't have a car, call 311 and we'll get you there. Again, these other sites, once we announce them, I think the goal is as much as possible to have fixed locations that are predictable where people can go, except for these mobile sites, which are designed, again, not to be a pop-up where the public comes, but designed to go to specific facilities where, as what was done today, there can be large-scale testing in one location for a population that's particularly vulnerable.
If you had any specific medical questions too, we have one of our physician directors. If you have.
Is the testing here, is it being done outside? Is that what that area is?
It was already done.
You did have it?
Yep. Registration in there, and then they did it.
By the way, was this the first mobile?
We're done.
First mobile site?
Yeah, the first one.
Okay.
Great, thank you.
Thanks, everybody.
Thanks.